absolutely. So Danielle, I made you a co-host, so I just wanted to begin by thanking the folks from Special Health Services for joining us tonight. We had 31 register for this particular meeting, so I'm glad that you all could be on, and I'm sure that there's going to be a few that are coming on like right now.
Yeah.
But we're just gonna move forward, and if you
already said you're not gonna kill me after I explain.
for those of you, if you're not going to be the speaker, if you could put yourselves on mute for a while, and then they'll stop intermittently and see if you all have questions. So with us tonight from Special Health Services is Heather Capella, if you want to wave. And then we have Danielle Hoff. And then we have Kim Ruby. Kim is on, her picture is not on, but there she is. So I have loved this Special Health Services for a very, very long time. I think they're one of the agencies that really, really cares about our families that have kids with special needs. So without further ado, I'm going to let them go ahead and start, and just take it away.
Good. Okay. Remind me, I don't use Zoom a lot. I don't see a button to share. Oh, yep, there, just right in front of my face. Never mind.
So
I found it. Okay. Give me 1 second. Let me know when you can see my screen.
sure can.
Okay, perfect. We will go ahead and get started. And Heather's gonna start with the PowerPoint, and then I will wrap it up at the end.
I need to figure out how to change my view so I can see my notes screen.
You could probably just pull the PowerPoint up on a different screen if you want.
Yeah, Heather, you'll just have to pull it up on your screen and then let us know when you want us to advance the slides for you.
Heather, if it automatically went to full screen when she started sharing, you could go, there's a little button up in the upper right corner that'll give you an option to exit full screen. It's the view button, little grid. If you click on that, you should be able to exit full screen.
I have it in side by side, but I'm trying to have the PowerPoint on my other screen separate from what she's sharing is what I'm trying to figure out.
Yeah, but it might be in full screen as well as side by side. And if you exit that, then you can make it a window instead of it taking your whole screen.
Standard.
Yeah, there's standard side by side, but the bottom thing is exit full screen is what I'm looking at. Okay. I'll mute myself.
I'm gonna try and pull it up again. Okay, so I'm gonna try to get to the page she's on now. Okay, so like Deneen said, I'm Heather Capella. I'm one of the program administrators with Special Health Services, and I'm also the state school nurse consultant. And then Danielle, who will present on the second half of this, is, I guess, my partner in crime. Special Health Services has been known by a few different names over the years. You see a lot, it'll say CSHS, and it was Children's Special Health Services. We can go. Oh, I was going to talk about our funds. Our funds come from the Maternal Child Block Grant, and the 2019 to 2021 biennium is about $3.3 million. A major funding source includes the Title V Maternal and Child Block Grant, which I guess I just mentioned that. Go to the next slide, Danielle. Hopefully I will too. So according to the 2017-2018 National Survey of Children's Health, approximately 18% of North Dakota children from birth to 17 have a special health care need, compared to about 19% in the United States. And so that's some of the services we provide. So our mission at Special Health Services is to provide a system of care and services for these children. There was approximately 12,500 newborns and families that were served through the newborn screening program, which is also a part of our division. And then Special Health Services also served approximately 2,000 children with special health care needs each year. We work with a variety of partners to improve the healthcare service. We have a medical advisory council and also a family advisory council to help us with those. We have state level staff that work on a variety of special projects to improve children's health. A few examples of that are newborn screening. They have an advisory council as well. We have the EDDI program, and then Medicaid claims, payment provider enrollment, health transition, medical home, and early intervention are a few other ones.
Heather,
Yeah.
can you tell folks what EDDI stands for?
Oh yes, early. Now you can. It's early hearing detection. No, yeah, detection, intervention. Yeah. Okay. And Joyelle in our office, who is the newborn screening director, is also a part of the EDDI. I can't remember exact her title with that now.
She's the Early Hearing Detection and Intervention State Coordinator for North Dakota.
There you go. Okay. So Special Health Services, we determine eligibility and coordinate care for children who are eligible through our diagnostic and treatment programs. We also provide care coordination support for children and their families who contact the state or who participate in select state administered programs. A couple of programs that we will do the care coordination is the Cardiac Care for Children program. After a child sees a pediatric cardiologist, we help with that visit, and then I review the medical records from that visit. And if there's any additional services I believe that we could help them with, I will reach out to the family and discuss those with them. We collaborate with, okay, go ahead. I'll go, next slide. Okay, so here's a couple of the programs I guess I've already kind of talked about, and we'll go into more detail about these in the next few slides. So our coordinated services program, we have the metabolic food or formula for individuals with PKU, or phenylketonuria, I can't even say the word, phenylketonuria, you guys, PKU, and MSUD is maple syrup urine disease. Some other programs, coordinated services, is our multidisciplinary clinics, and then the cardiac care for children program I talked about, and state school nursing. So the metabolic food program, this program was added in August of 2001. We maintain some inventory at the office. So when somebody forgets to maybe order their food ahead of time, we will have some that we can get out to them, overnight it to them. Now that we all are working from home, we've kind of had to change that up a little bit and do drop shipping right from the company to the families, which I think has really improved that access for the families. Routinely, about 20 to 25 individuals in the state order formula or low protein foods through us. And then for this program, females are eligible up to the age of 45 and males are eligible up to the age of 26. Go to the next screen, Danielle. The multidisciplinary clinics, there's 7 types of clinics or specialty programs that are available through Special Health Services. Some are managed directly by us, while others are contracted services that we help provide. There's no charge to the families for clinic services, but third-party payers are sometimes used for billable services if available. Clinics make a positive difference in the child's overall care. It's essentially a one-stop shop for these families. Like the cleft lip and palate clinics, Danielle and I are the coordinators for those, and we administer them ourselves. And there's about 10 different specialists that come to each clinic, and the family can see each one of those providers at that same visit. It's usually about an hour and a half to get them through the 10 different providers. And then at the end of the clinic, all those providers would come together as a team and discuss each child and give recommendations. And then we type up that report and send it out to the family. If they have any questions or need any help with coordinating any of the suggestions that were given by the team, then Danielle and I would help set those up for the family. And then we also have a directory that includes all the clinic dates, local contacts, and sites, and it can be found online.
Heather, if I could, I'll just mention that the monthly clinical directory I put into the e-news that goes out every week. So it's there for you all to access as well.
No.
It really is. Go ahead to the next slide, Danielle. The Cardiac Care for Children program. So with this program, we will help with that initial pediatric cardiologist visit. And then some routine tests like a chest x-ray, if they have an echocardiogram, an electrocardiogram, and there's a few lab tests that will help cover as well. They register at the time of the appointment. Sometimes it happens after when they reach out to us, when they learn about the program. And like I had kind of already mentioned, then we'll review that report and try to reach out with them with any other services we may be able to help them with. Oh, shoot. Okay, go ahead, Danielle. The financial coverage program. So we have a diagnostic portion of this and then a treatment portion. And so say a child goes to see that pediatric cardiologist and they're diagnosed or found to have a cardiac condition. We would then reach out to them. If they need further testing, they haven't quite been diagnosed, we would look at that diagnostic program to have them apply for to help. With a diagnostic program, we don't look at income. It's simply based on the condition. But once then they're maybe diagnosed or it's ruled out and they no longer need our services, that's okay. But if they're diagnosed, then we can look at that treatment program. That we do look at income, but there are a lot of ways that we work with the family to try and help them out the best we can. Another coverage program that we have is the Russell-Silver syndrome.
Heather, do you want me to take over? Or do you want to? You're doing a great job. So if you want
Oh
to
yeah,
keep going,
I was
that's
going to stop
fine.
at cardiac. Okay, nope, you go.
No, that's
Sorry.
okay.
It
You
just
did
was
great.
rolling.
All right, sounds good. We can just briefly touch over the diagnostic and treatment again. So like Heather said, the financial coverage program is a really large portion of what our division has in-house, I guess you could say. And so like she said, that it's a kind of a two-part program. And so for this, there will be the diagnostic and then the treatment. And so with the diagnostic, there's a lot of similarities. So we have a list of eligible conditions. So there's over 100 eligible conditions that kiddos can have to apply and be eligible to be on the financial coverage program. And so for the diagnostic portion, as Heather said, it doesn't look at income. So doesn't matter how much the family is making. The main goal is really to promote that diagnosis. So as long as the providers are looking for a diagnosis that is one of our eligible conditions, we can help cover all of those tests and whatever it is that they're doing to help try and confirm a diagnosis. And so once a condition is confirmed, then families would bump over to the treatment program. And so again, we would help cover those expenses that are related to the treatment of that condition. So say it's diabetes, so we can help cover whether it's office visits, insulin like prescriptions, supplies, things like that. But I will also mention that a lot of us or a lot of families do have other coverages, health insurance coverages. So what we're really known as like a gap filler or payer of last resort. So if the kid has Medicaid or a private insurance like Blue Cross Blue Shield, it's going to run through those first. And then what isn't covered by those insurances, that's where SHS or Special Health Services goes ahead and picks up and can help cover some of those expenses as long as they're related to that condition. And so we do look at income, like Heather mentioned. The eligibility criteria is at 185% of the federal poverty level. So families that fall above this, I don't want to get too much into the weeds with just an overview of our program, but families that are over our income eligibility doesn't necessarily mean that they don't qualify and can't benefit from our program. And so Tina out of our office runs some numbers and comes up with what we call a cost share or a monthly deductible. And then they work with her to kind of get that exhausted each month, and then we can go ahead and help pick up. So don't let the income, requirements shy you away. We're here to help, and we'll work through that. Another program that we have, it's pretty specific. It's called the Russell-Silver Syndrome program, and this is one of our state mandates that we have. And so Russell-Silver is a rare genetic disorder, and so the treatment is really costly. And so this became a state mandate just because the family went to legislation and really fought and advocated to get this covered for kiddos that have Russell-Silver syndrome. And like I said, it is rare, so we only have a handful of kids that are utilizing this, but just know that this is available as well. And then lastly, Heather already kind of touched upon the newborn screening and follow-up program. And so there's two main nurses that work with this program. And so their main goal is to really, making sure that all newborns, I guess I go back up a little bit. So all newborns are getting the right care, making sure that they're getting their screenings done, things like that, just in case if anything comes up, that it's detected early, and then they can start those interventions, as soon as possible. And so there's three categories or main areas that they kind of focus on to make sure that it is that the newborns are getting quality care. And so the first one is the blood spot. And many of you probably have seen this being done in the hospital. This is when they poke the baby's heel, and then they do what they call the newborn screening. And so this is looking for any genetic like disorders and things like that. It screens for, I think it was like over 50 disorders that they are screening for. So just making sure that they can catch things early and get that treatment started just to help reduce the incidence of long-term effects. And the second group second area that they focus on is the hearing. The North Dakota Early Hearing and Detection and Intervention Program, like Heather mentioned earlier. So this is another area, just making sure that each baby has their hearing screening before they get discharged from the hospital. And then lastly, the critical congenital heart disease. And so they want to make sure that babies are being screened. And this is done by just using that pulse oximeter, non-invasive, just looking to see how much oxygen is in the blood, which could be a sign for the critical congenital heart disease. So just making sure that every baby is being screened for this as well. And then our last section, this is Children with Special Healthcare Needs System Enhancement Program. And so SHS, really focuses on bettering the care for children with special healthcare needs and their families. And so we do a lot of partnerships and collaborations and focusing on different priorities, I guess you could say. So this is just a handful of some of those examples. And there's just two main ones, I guess, that I thought I would pull out just for tonight. The first one is the family professional partnership. And I thought this one was important just because it shows how much we value families and their thoughts and feedback and things like that. So like Heather mentioned earlier tonight, we have a family advisory council. And so that is a group that meets with our division, and it's composed of families that have children with special health care need. And they really provide us with a lot of just valuable feedback, areas that they feel needs more advocacy, what they're seeing, with their own experiences. And, it gives us a really good idea of, what we need to focus on as, a division and some of our priorities. And so if anyone is interested in joining our Family Advisory Council, we meet, I think it's 3 times a year. And so our application is found on our website. So if anyone is interested, feel free to reach out to us, and we'd love to have you on our council. And then the second bullet I wanted to pull out is our transition to adult healthcare. And so transition from pediatric to adult healthcare, this is one of our main priorities. So our division participated in a needs assessment, and this area was found to be, our data could be improved. And so this is one of our main priorities that we're really working on as a division to help those transition age kids know, how to make an appointment, what are my medications for, starting to kind of take ownership of their healthcare. And so that is, I guess, one of our biggest priorities that we are working on currently. And with that, that is all we have. Any questions for Heather or I? I know that was a lot of information in a short amount of time. No questions? There's got to be one question.
Danielle, this is Kim. Could you elaborate or explain how a family could get involved with one of the multidisciplinary clinics that we run through our state program?
Yeah, let me find that slide. Okay, so I think this might be all of them. I don't even know, but we do have quite a few different multidisciplinary clinics. So quite a few of these are held at the CTC clinic at Sanford in Fargo. So if anyone is interested in various types of multidisciplinary clinics, really all they need is a referral from the provider sent to Sanford CTC clinic. And we can certainly, if you want to reach out to me, I can help initiate any type of referral process as well. But they have a lot of very specialized clinics, which is nice. I'm trying to think. So asthma, I think that they would just reach out. Heather, you can correct me if I'm wrong. Reach out just to the coordinators there. And these are all listed in our multidisciplinary clinic booklet directory that we put together each year. It'll have the name and number and contact information of how to schedule an appointment and things like that. But if you have any questions as far as the patients that they see during some of these, feel free to reach out again. We do have like our near developmental, it's a full screening for like ADHD and autism and things like that. So that's always a really nice clinic to get into. And it's, again, free of charge. So that's really nice as well. questions on that? Questions on our financial program? I know that's a pretty big program and pretty underutilized as well. So if any of you know families that could just use a little more assistance, if you want to see our list of eligible conditions, it's a little confusing. You know, it's not all inclusive, I guess you could say. So I believe how it's listed is like syndromes. And so that really means any syndrome, you know, any condition that ends in a syndrome. And so, you know, if you have questions as far as conditions we will cover, just feel free to reach out to our office and we can certainly help walk you through it too.
Danielle, I'll also, when you send the link to the PowerPoint, I'll also include the website that, or the page that also includes all the list of everything that you guys might cover.
Sounds good. Yeah, and you know, a lot of our conditions are, I don't want to say common conditions, but we cover things like asthma, diabetes, syndromes, cardiac conditions, cancers. So it's kind of a large variety of different conditions. So like I said, if you know families that are struggling or could use some help, or things just aren't being covered, therapies or services aren't being covered by primary insurance, feel free to let us know and we can certainly help walk them through the program.
How many of you that are on the call now, is this the first time that you've heard of special health services? Any of you?
Hey, Deneen, it's Sammy. I just recently heard about the program through Vicky, and I do, Grace has CP. She's got primary insurance and currently has secondary insurance, but I do know quite a few families that have primary insurance. And I guess my question would be, for some of those families, they have kids with CP that have really high deductibles and out of pockets. Does this help them with maybe some of that co-insurance for therapies, or is it only things that are not covered by their insurance?
Kim, you might have to jump in. My initial response would be, it would be for services that aren't being covered, but I will let Kim hop in.
So it's anything that is medically eligible for the treatment of that condition, as long as the family is following the rules of their primary insurance. So oftentimes we will pick up whatever is left for out of pocket if the family qualifies financially, or if it's a non-covered service through their primary insurance. Like, let's say, I just like to use diabetes as an example because we've been paying a lot of diabetes this year, but let's just say like a child's continuous glucose monitor for diabetes isn't covered through their primary insurance. We would just go ahead and jump in and help pick up that expense. So if your therapies, let's say they cap out, I know certain insurance companies maybe have a cap on insurance. If you've met your threshold for that year and they're not really budging at all, we can just go ahead and jump in and help cover some of those expenses as well. Again, we often tell families that even if you see that you're technically over income, like Danielle had mentioned, we can make every family eligible with a cost share. And what we use with that cost share is basically we take the amount that you're over income, divide it by 12 to get a monthly amount, and then that monthly amount is your cost share. So that's how much you would pay out of pocket before we would kick in. But we also take into consideration expenses that the family already has that they're paying out of pocket for. So let's say you're paying out of pocket for an insurance premium every month. You have another family member who's maybe on a medication that you're paying for out of pocket every month. You have travel associated with that child's condition every month. As long as you have documentation of those out of pocket expenses, we can use those to actually spend down your cost share. So I always tell families, I know it sounds, on paper like maybe you won't qualify, but if you just visit with us about some of those out-of-pocket expenses you have, those really do add up. And a lot of times it's worth your while to check into applying so that we can kind of work that with you. And a lot of families don't realize the amount of out-of-pocket they have until we actually sit down and start talking through those things. And I think that's why it's so important that the care coordination that Danielle and Heather and Tina in our office are doing, and then Amy with long-term follow-up, and I think she's even on tonight, why that's so important as well, because there's a lot of things that families just don't know about until we start kind of asking those really open-ended questions with them. So that was a really long drawn-out answer to say, yes, we would cover those.
Thank you. And I definitely know quite a few families that I will gladly share this information with.
Thanks, Tammy. Anyone else have any questions at all for Kim, Danielle, or Heather? Don't be shy. Any comments? Does anyone on the line use the multidisciplinary clinic? Why a quiet group? Okay, for the good of the order, last chance, if you have any questions at all.
Danielle, are there only clinics in Fargo or are there other places for clinics to go to?
So it kind of depends on what kind of clinic you're looking for. So asthma is in Bismarck and, oh gosh, Heather, help me out. Bismarck and
Dickinson.
Our autism clinics are in, that one has one in Fargo and
Belcourt and Minot. Trying to think. I think that's it.
okay.
Grand Forks also at All True has their own clinic. So a good thing to point out about this slide is that these clinics that are listed here are the ones that Special Health Services funds, but that multidisciplinary clinic directory that Danielle had referenced actually has a compilation of all clinics throughout the state, regardless of if they're funded through Special Health Services or not. So even though these might be the ones that we fund, that doesn't mean that there's not more out there that we partner with or collaborate with.
Great.
Is there one in particular that you were looking at or just in general?
I was kind of looking for the asthma one.
Okay, great. And we could send over, or Deneen, when she sends out everything to the group, we can include our directory. So there you'll see all the locations of our asthma clinics and then contact information as well.
Can you put the slide up with your contact information?
Yeah. And I think this just has our generic, admin, but we could, I'm trying to think. Even if anyone had questions, they can certainly just email this email, or this is our main line phone number, and just let them know you have questions about the program or things like that, and they can certainly direct you in the right direction. That's just our administrative assistant contact information. Or Deneen can share our direct lines as well. That is just fine.
I was going to say, yeah, you could add my email, Deneen, when you send it out if you wanted to.
Sure.
Yep, mine too.
Will do. Any
I have
other
a question.
Go ahead, Amy.
This is Amy. Yes. I'm wondering about the medical food for PKU and MSUD. Is there any reason why it's just those two diseases?
Yeah, so good question. This was also due to a state mandate. And so families were fighting for the, and I believe I'm right, Kim? This was a legislation one too. Am I right?
Yes.
Yep,
okay.
you're correct.
Oh yeah, Janine, you know too. But basically, families went to legislation and fought to have this included as a state mandate. And so that is why it is pulled out just these two.
Okay. My daughter has tyrosinemia, which is similar to PKU, but more rare. I think she's the only kid in the state of North Dakota that has it. And so this always frustrates me. I just wrote out a check for $362 for her formula for the month. So it would be nice to have.
Yeah. Are you guys on our financial program? Was that Amy?
Yeah.
Amy, can you still hear me? Well, maybe we lost her.
I'm back. Sorry,
Oh,
unstable.
there you
internet.
are. That's okay. I was just asking, are you guys a part of our financial program right now?
We are not. I've not looked into that recently. I think I did a while ago, but thought we probably had too much income to qualify.
Okay. Yeah, if you want, you can certainly reach out to myself, and we can connect with Tina, who kind of oversees that program, just to kind of run some numbers, just to see if it would benefit you, to see if we can help cover some of those expenses for you.
Okay.
This is going to age me a little bit, Danielle, but this was the first legislation that I worked on, was this PKU legislation
Makes
with
sense.
families. So yeah, so that ages me quite a lot. That's at least 20 years for sure. And the other thing, and Kim, I don't know if you wanted to mention it, but in this legislative session, there is a bill for metabolic supplements, correct?
Yes. So I don't know if Amy actually got to join or not, Amy Burke from newborn screening. But what's really nice about newborn screening is we just started a long-term follow-up program where Amy, our nurse with newborn screening, is actually following children up until age 6. And in doing so, she has found that several of our babies who needed metabolic supplements were actually having some difficulty obtaining them through their insurance or through North Dakota Medicaid, because of coding issues and solubility on certain vitamins and different issues. And so we actually worked with North Dakota Medicaid recently and submitted a request to have their state plan modified, which they then took to a special subcommittee, which Deneen is part of, and had that evaluated, and then actually asked the subcommittee whether or not this would be something good to take towards legislation. And so this year there actually is a bill. It's Senate Bill 2224, and it is for the coverage of metabolic supplements by North Dakota Medicaid. And in the amendments that were recently made, it was suggested that this actually be looked at on an annual basis with collaboration between the Department of Human Services, where North Dakota Medicaid is, and the North Dakota Department of Health, so that we can, I guess, stay up on what our families are needing, what we're seeing, where the demand is, what's not being covered, whether or not there's certain forms of supplements that families need that they're having difficulty obtaining, and all of that. So we're really excited that that seems to be moving forward. I do believe it just passed out of subcommittee over on the Senate side. I don't think it's been voted on on the floor yet, but I could be mistaken. But we're really excited that that seems to be making progress and moving. So we're keeping an eye on that one.
And Kim, while you're at it, can you talk a little bit about the glucose monitors as well?
Yeah, I sure can. I feel like I'm stealing the thunder away from my people, but so that was another area where, like I said, we really kind of evaluated where some of our spending has gone. just in the last year or so. And we were really seeing an uptick in how many continuous glucose monitors we were paying on our children with type 1 diabetes. And we worked with some of the diabetologists out of Fargo and also our special health services medical director. And they really felt like this is something that's medically necessary for these children to avoid hospitalization and potential crises. So again, we kind of did the same thing. We had visits with North Dakota Medicaid and other insurance carriers. Most other private insurance carriers actually do cover continuous glucose monitors, but North Dakota Medicaid currently does not. So again, we had requested a state plan change, and this was another one of our suggestions that they had taken back to the subcommittee and asked whether or not this would require potential legislation. This one does have a higher fiscal note, so it was decided that yes, that would probably be the best route. And so this one has resulted in House Bill 1288, which again has had a little bit of amendments. So, we were really hoping that maybe it would be covered for the lifetime population. However, the thought was that that might cost a little too much of North Dakota Medicaid. And so the recent amendment, I believe, has actually brought that down to age 18, but we're still pretty happy about that. And so that one has also recently passed out of committee. And I don't think that that one's been voted on the floor yet, but we're really optimistic and it looks like that one has potential as well. So we're really excited. I feel like our partnerships with North Dakota Medicaid has drastically improved within the last year. And I think that, even though our relationship was good before, we're finding different avenues to kind of make our voice heard on the behalf of families and in collaboration with families. And we're just really, I guess, eager to see how this is going to move forward by the end of legislative session. Is
Great.
there anything in particular you think I should add to that, Deneen? I think I
Nope.
covered it okay.
You did wonderful.
What did you say was the Senate bill number for the metabolic supplements?
Sure, that is 2224. So it's 2224.
Okay. And then do you know what is considered a supplement exactly?
Um, Basically anything that does not require, uh, I'm trying to think of the coding that the pharmacists actually use, but it's those particular things that are required for metabolic treatment that don't always have the special prescription coding numbers assigned to them. And so those are what they're considering supplements. And I think it was causing a big issue with billing because it was missing those specific numbers, but yet the physicians were saying these are medically necessary for treatment. So by making it mandated through legislation, it's kind of our way to make sure that even though those don't necessarily have the billing component in place, that those still would be covered by North Dakota Medicaid.
Thank you.
And I wish Amy Burke was on the line because she's really been working on like the pharmacist side of what those codes actually are. And I feel like I'm butchering it right now by not thinking of the word for them. And Danielle's kind of laughing too because I know she's thinking the same way I am.
Amy, if you need any help with that and who to contact as far as legislation, just let me know and I'll help you.
I can do that. Thank you. The supplement thing threw me. I don't think my kid has any of those or takes any of those. She's only on a formula. So,
And that could be, Amy. A lot of times our children who require formula for treatment don't always have supplements as well. And then we have some children with certain metabolic conditions or disorders where they only require the supplements, but they don't necessarily require the formula. And like Danielle had said, formula is something that we are able to cover through our office, through our financial coverage program. And hopefully that's one more thing that we can maybe bring forward to North Dakota Medicaid and the committee going forward. But we decided supplements and continuous glucose monitors were maybe a little bit more up our alley at this point since we've gotten a little bit more resistance on the formula side.
sure.
Okay, any other questions or comments at all? Lori, Roxy, Renee, I'm gonna start calling you out. Joan, Jennifer, Heidi, Emily, Carly. Well, I just want to thank all three of you for, oh, where am I? There I am, for joining us tonight. I just really appreciate our partnership with Special Health Services and all you do for families across the state. I will send out all the, oh, there's a message from Carly, hang on. Oh, the North Dakota Brain Injury Association didn't know much about this program, so wanted to learn more. Thanks, Carly, for that comment. We'll send out the slides and everything and some contact information so that you all have it, as well as the scheduled clinics every month are in the, we'll send that out, as well as the diagnostic list. And just know that the calendar or our weekly e-news also has those, the multidisciplinary clinics every month too, even the ones that are not, well, I guess it's the ones that are sponsored by SHS. So if you have any questions at all about those two pieces of upcoming legislation, just let me know and I can help with that too. So thank you, ladies, for joining tonight, and for all of you for, thank God the electricity didn't go out while we were on. I was a little bit worried about that too. So I hope everybody stays warm and that your electricity stays on. I have a son that's a lineman and he's been out for quite a while. So have a good night, everyone, and thank you again.
Have a good
Thank you
night.
for having us.
Thank you.
Yeah.
Thank you.
Thank you.